Hi, I'm Dr. Kelly Starrett with H-Wave. One of the questions that comes up a lot is there a minimum effective dose of H-waving? So if I'm using the H-wave in this non-fatiguing muscle contraction way, where I'm trying to get movement in the system to dump the lymphatics and tell my brain it's safe to move or to load a tissue, think about it this way. Any movement that you would do, say, on the bike, hey, is a 5-minute bike ride valid? Yes, absolutely. Any muscle contraction, any movement that I'm doing is gonna always be better than zero, right? So any movement that I can get in. But oftentimes what we're finding is that if we can even just get 20 minutes throughout the day, that aggregates into a lot of decongestion of a swollen or congested tissue. What we find is that if we said to people, hey, would you benefit from a 20 or 30 minute walk? Yes, absolutely. 20 or 30 minutes of zone 2 cardio on a treadmill or on an exercise bike would be a lot. Well, we can do the same thing here and apply that same rubric. That 20 or 30 minutes would be a really solid, effective dose. But what's nice is that when I have extended windows, certainly I can pump more. Ideally, what we like to have our athletes and clients and patients do is engage in lots of little frequent sort of sessions throughout the day. Leave the pads on, plug and unplug the device, but if we can get a little bit of decongestion or movement or some pain control in the morning, we might be able to hit it again in the afternoon, and then again in the evening for a longer session if I have some agency. And that allows me to sort of stay ahead of the congestion, maybe tamp down some of the pain responses to these acute problems that I'm having. But bottom line is, I shouldn't ever think, hey, there's no, what is a minimum dose, or is it okay if I just do 20 minutes because that's all I have? Absolutely. Any movement of the body is going to be net positive to the system. Any motion in a tissue that we're trying to decongest or manage with pain is always going to be a net positive. So the bottom line is, pump when you can, pump early, and pump often.